following program is a peer-to-peer advice show and does not diagnose mental health conditions. If you're seeking social services, please call or text 211 or go to 211.ca. Hello, listeners around the world on radio, streaming, and podcast services. This is It's Not Therapy. I'm Liana, and I am not a therapist, but I am your source for navigating the madness of mental health using my top 10 sayings for going good crazy. This week, we're going to talk about the problems with mental health and the medical system. My guest this week is Dr. Robert C. Smith, a medical doctor and author of Has Medicine Lost Its Mind? Robert is in the U.S., but I hear plenty of stuff up here in Canada as well about humiliating and degrading treatment when people seek help. I personally got it from both ends in the past. There's nothing wrong with you. You're depressed. When I actually had a rare autoimmune disease, and you're functioning reasonably well. The product is your environment. When I sought mental health treatment, everybody was pushing me somewhere else, so I was somebody else's problem. So when I sought treatment for my body, people told me it was in my head. When I sought treatment for my head, I was told the problem was my environment. And that was true. But it wasn't until I reported being stalked and got put in touch with York Region Victim Services that anyone took the time to tell me what the actual problems were in my environment. But I ended up getting yelled at by a cop too. So we have a systemic problem here, and obviously, focusing on one part of it at the time is like looking through a pinhole with one eye. But the medical system is a snapshot of the system isn't set up to do that, right? Since I was 15 years old, I've had doctors telling me to reduce stress. Gee, thanks. That's so easy when, if you're a teenager, you're not in control of your environment. Really, when you're an adult, you can barely pay your bills. Thanks, doc. In a perfect world, schools, churches, employers, and yes, medical doctors would be routinely on the lookout for signs of acute stress and not just teach healthy skills, but actively create healthy, emotionally safe environments. But classes are too big to start doing that in most schools now. And everyone is just trying not to get yelled at by parents or even sued. Teacher burnout is a serious problem. We've done past episodes on that on our program about that. So we end up, by the time some people are teenagers, they have physical symptoms caused by stress, but they're not taken seriously by, doctors, yeah, but also by anyone. We have this cultural stigma that teaches us that if it's all in your head, then it's a weakness of character as opposed to something you deserve help improving. And that's not true, that it's a weakness of character. But there's also a continuing stigma against things like antidepressants, which means that a lot of people are suffering needlessly and struggling through lower quality of life than they deserve. You don't have to be on antidepressants forever just because you take them to stabilize in the short term. But the idea of seeing 4 different doctors over a period of 6 months to get a single prescription, that's nobody's idea of a good time. And anyone who's dealing with a relative who's addicted to a prescription drug, like Xanax is a common one, they can tell you that this addiction is facilitated by medical neglect, not from doctors who pay attention. Again, however, just because some people get addicted to a drug doesn't mean it isn't safe used as directed on a temporary or occasional basis while you're working on those other lifestyle changes that do take time. A 14-day prescription for Xanax isn't going to get you hooked, especially when you're not taking it every day. But drugs aren't the permanent solution to our mental health crisis. Those lifestyle changes are. We have to stop killing ourselves through our jobs, repeatedly pushing ourselves past the breaking point in school and at the gym, and learning realistic goal setting and healthier mental habits. These are essential to living a healthy and productive life. Easier said than done, right? More on that next week. Like it or not, your family doctor is often the first person with any sort of authority in a position to tell the people around you that conditions like anxiety and depression affect the body as well as the mind. But that conversation often doesn't happen. You'll dutifully go to the doctor, be told to reduce stress, work less, sleep, exercise, and relax more. And the people around you will say, that's nonsense. You have to work harder. You have to stop being so annoying. You have to stop being so weak. You have to get tougher, stronger, faster. And this is why you're seeing doctors write prescriptions for things like walks in nature. Because if a doctor writes a prescription, people see it as more real. We can do something to change all of this mess. But that only happens if collective mental health becomes everyone's collective responsibility. And after the break, we'll talk to a medical doctor who is on a campaign to try to change the healthcare part of the system. Dr. Robert C. Smith, author of Has Medicine Lost Its Mind, will join me after the break to talk about what he's seen from his end of the story. Do you have a story you think would be good for the show? Are you interested in sponsoring the show? Liana at nottherapyshow.com. At nottherapyshow.com is the website. At nottherapyshow on social medias. Liana at nottherapyshow.com is my direct email, by the way. Should have made that clear. When we come back, Dr. Robert C. Smith, Has Medicine Lost Its Mind on It's Not Therapy. The following program is a peer-to-peer advice show and does not diagnose mental health conditions. If you're seeking social services, please call or text 211 or go to 211.ca. We're back in It's Not Therapy. I'm still Liana Kersner. I'm still not a therapist. And it is time for the interview. I have Dr. Robert Smith. He is a physician. Robert, internal medicine, correct? In primary care?
That's correct.
Is your specialty. And Robert is here to promote his new book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure It. Came out on March 4th, so you can get it right away. Robert, I want to start with something you talk about that I think is important to define before we dig in. The idea of the mind-body split in modern medicine. I'd like to start there. Explain to listeners what that is and why it's relevant to the issues with the system.
Yeah, it's a critical question. Thanks for inviting me. I'm honored to be here. The mind-body split basically means that medicine has split away the mind from the physical body, and that it focuses then just on the physical body and its diseases and excludes the mind. And medicine didn't always do this. From the 5th century, time of Hippocrates, 5th century BC, up until the scientific revolution in the 16th and 17th centuries, medicine united the mind and the body. People with bipolar disorder, or what they called then melancholia, were seen in everyday physicians, just as where people would say diarrhea or headaches or something. But at this point in the scientific revolution, scientists, and this wasn't just in medicine, it was in physics and in mathematics and a host of places. Science was beginning to get much, much stronger and more assertive. The church had ruled everything for the preceding millennium up until that point. But at this point, medicine became much more assertive and wanted to start doing dissections of the human body. Of course, that's the basic science back at that time. But the church had always prohibited that from the time immemorial. And so physicians had always dissected goats, cows, pigs, and the like, and inferred that what they found there was like humans, which of course is grossly wrong. Well, in 1537, Pope Clement allowed dissection of the human body for educational purposes, but with one proviso, the head must first be decapitated and turned over to church authorities. It's kind of grisly, and who would then bury it and provide the right services. Medicine got the body from the neck down. And that launched it. A century later came along all the philosophers you've heard of, from Descartes to Locke to Hobbes. They then cemented this idea that the church would handle mind, spirit issues. That's why the church wanted that. And that's why they insisted on that. And so these philosophers, in a sense, compromised with the church so that the church got the mind, spirit, soul. Medicine got the rest, from the neck down, all the physical diseases. And from there on through the ensuing centuries, medicine focused entirely on the physical body and its diseases. And so that, in essence, is the mind-body split and how it's happened in medicine. It was incredibly effective. In the last century, from 1900, the life survival at that point was 40 years. By the end of the century, it was almost 80 years. That's a doubling of life survival. This is a dramatic change. There have been no improvement in life survival from the 5th century BC on. This is the first time medicine had really had any impact. And so it's highly effective. The problem, however, is that medicine did not grow and mature and include the previously excluded psychological and social and mental and emotional aspects of medicine. And this became a terrible problem because all the acute diseases that medicine had cured that led to improved life survival, now we're faced, mental illnesses is becoming prominent. And also chronic diseases are becoming prominent. These, of course, require attention to the psychological, social, emotional factors that medicine excludes. And so it has proven, has led to a terrible mental health crisis. I'm sure your listeners are aware of this, especially since COVID. Here's the problem. And this is what medicine is not doing, that medicine has not grown and matured as it should. Right now, the mental health crisis, many people don't understand this, and it's kind of scary when you think of it. But the mental health crisis is due to the fact that primary care physicians, like myself, I'm certainly no exception, like myself, conduct 75 to 80% of all mental health care. Here's the problem, Liana. Medicine didn't train them for this. Medicine ignores the mental health aspect, and so hasn't trained them for this. And the downside of this is incredibly bad. Unrecognized problems with suicidal patients. Medicine didn't train them in that. Many of these could be prevented. They see the doctor in the month or so before them, most of them. There were 200,000 deaths from physician-prescribed opioids. Physicians aren't trained in using opioids. This could all be prevented. And the downside is even greater. There's something like 90 to 100 million people with major mental disorders at any one time. Most of these people are not even recognized. When they're recognized and treated, it's usually wrong. And so what happens with unrecognized and poorly managed mental health care? The depression is overlooked. Anxiety is overlooked. Addiction problems are overlooked. This results in divorce, school failure, job loss, addiction, incarceration, homelessness, and on it goes. But don't blame the doctors. It's not their fault. They haven't been trained. They're not trained. And in fact, I've talked to them all the time, and they'll tell you, Bob, one of them said, there's no psychiatrist in my town. What am I supposed to do?
Yeah.
And another one says, there's 2 psychiatrists in my town, but it takes 9 months to get a patient in to see them.
Yeah.
And so so the point here is psychiatry sees no more than 12% of all patients in the US. Psychology sees another 12%. That's why the remaining 75% are seen by untrained primary care physicians. Now, the solution to this problem must be obvious. Train the doctors who provide the care. But medicine refuses to do
Mm-hmm.
this.
Mm-hmm.
And you asked rhetorically, has medicine lost its mind? I
Yeah.
mean, why does medicine not train its doctors to care for the most common health condition they'll see in practice? Has medicine lost its mind? It's crazy.
Yeah, and this is true not just of doctors, it's true of police officers, it's true of firefighters, it's true of paramedics, it's true of teachers, it's true of managers. There's all these primary, it's called primary care because you're the primary contact, right?
Yeah.
And
Yeah.
doctors are in this double bind because when finally someone decides to go to the doctor, they think there's something real with them. And when you suggest, like, hey, maybe your stomach ache is caused by depression, or maybe your chronic headaches are tied to anxiety or burnout or overwork, they feel dismissed. Right. They
Yeah.
feel like you're saying it's all in your head. But these are physiological processes that happen with our body chemistry, our nervous system. You can't just, as you said, cut a person off the head and only treat that and not treat. Most of the people I see as a peer counselor, one of the fundamentals, diet, sleep, exercise, something,
Yeah.
is compromised. And they've told their doctor this, and well, something's breaking down at some point. I mean,
Yeah.
you talk about the importance of integrating mindfulness and exercise into treatment. What does mindfulness mean to you? Because that's a term. You ask 12 people, you'll get 14 definitions, right?
Yeah, I mean it's an important term, and I have some good friends who work in the area. Uh, Mindfulness, just in a general sense, relates to meditation practices that raise one's self-awareness to what they're doing. There's also a tremendous benefit. I mean, Herbert Benson demonstrated that simple mindfulness techniques lead to a reduction in blood pressure,
Mm-hmm.
and it and then so on. But it is a powerful thing that people can do on their own, or which doctors, if they're aware of it, can prescribe for patients and advise they use it. And so I think it's a tremendous thing. But some of these things you're mentioning, Liana, um, diet, cigarette smoking, alcohol use, all of these things are implicated in causing most heart attacks, strokes, diabetes, cancer. And yet, medicine does not train its graduates in these lifestyle factors because they're all psychological and social.
Right.
People drink for psychosocial reasons, eat too much, don't exercise, so on and so forth. Smoke too much, for
Yeah.
example.
Yeah.
And all of these things can be addressed by the medical profession to prevent all these physical diseases we see, all the heart attacks, strokes, diabetes. 80% of those could be prevented if medicine addressed prevention. Now, how bad does medicine do on prevention? In 1970, 15% of the US population was obese.
Yeah.
It's 50% today. That is a terrible condemnation of medicine for not paying attention to prevention. Instead, what medicine does is let the disease happen,
Mm-hmm.
then it
And treat
treats
it.
it after the fact. And it just, it's a disaster that just goes on and on. And it is incredibly expensive.
Mm-hmm.
Our hospitals are filled with people with chronic physical diseases in this day and age. What if you prevented half of those? You would save tons of money. Insurance companies would save tons of money. Pharmaceutical houses. I mean, and the whole thing goes on. And so there is a tremendous, not only health downside to this, but also the financial side.
All right, Dr. Robert Smith, author of Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure. He's a primary care physician, internal medicine. Robert, can you stay with me over the break? We can come back, talk some solutions really quickly. All right, when we come back, like I said, solutions to how to fix this really messed up system where physical health and mental health are separated, with Dr. Robert Smith talking what doctors miss about medical illness when we come back on It's Not Therapy. The following program is a peer-to-peer advice show and does not diagnose mental health conditions. If you're seeking social services, please call or text 211 or go to 211.ca. We're back on It's Not Therapy. I'm still Liana Kersner. I'm still not a therapist. We're still talking to Dr. Robert Smith about what doctors miss about mental illness. And before the break, Robert took us through this amazing history. And I love this stuff. So I was like, oh, keep going. About sort of how we got here, how physical medicine and mental health got split, and some of the benefits to that in terms of things like life expectancy, longevity, the stuff we can treat. But Robert, you were saying the downside is we are very much a sickness-based system. We are not a health-based system. As you said, prevention is not taught. I was just talking to my husband last night. We just watched All Creatures Great and Small, which is a show about a bunch of country vets, right? But they deal with a lot of the psychology with dealing with the people who they have to get through to treat the animals. And it's taken place during World War II right now, and they were showing like how much it took to prepare food back then. Even when I was in middle school and high school, we learned how to cook. We learned nutrition. We learned what went into our food. And a lot of these programs now are cut. So I want to start here. When we talk about prevention, my God, we could talk for 4 hours and barely scratch the surface. So where do you want to begin in terms of prevention and mental health?
Yeah, the first place, what we need to begin is the system itself is not working right. And prevention efforts and so on will have to come after medicine makes a fundamental change. Right now, medicine provides no more than 2% of all training time. It's about 15,000 hours of training over 4 years of medical school and 3 to 5 years of residency. Only 2% of that is devoted to mental health care. That's a 5-week experience, usually in the 3rd year of medical school, on psychiatry. And most of those patients are not like the patients you'd see in practice. You know, they're very severely disturbed, not like the garden variety depression, anxiety you might see in practice. And so only 2% of time is devoted to training for the most common health condition they'll see in practice. Medicine has known this and known the problem since at least the 1970s. I'm certainly not the first one to talk about this. And prestigious groups like the Institute of Medicine, later the National Academy of Medicine, have said medicine needs to train primary care doctors in mental health. In fact, the primary care system has been called the de facto mental health care system in the U.S.
Yeah.
And people have been saying this since, I think that paper came out in 2000. And so medicine has known this for a long, long time, but done absolutely nothing. Its training in mental health and the other psychological and social aspects of medicine has not changed in 100 years. And quite frankly, they're not going to change if they're left to their own devices. This is why I'm getting out and going to the public, as it were. The public needs to get involved. The public needs to get angry and say, you are not meeting our needs. Now, you might say, how is the public going to do this? How will they be affected? Well, there's ample precedent for just this. Ralph Nader came out with a book, you're nodding, you know, with a book called Unsafe at Any Speed. This book, at the time, the auto industry didn't put seatbelts in cars. It was too expensive, and they were afraid people wouldn't use them and wouldn't buy cars. And they also had gear shifts were misaligned, so people went forward when they thought they were going backwards, and so on. Just a host of things. The auto industry knew it, but they just didn't do anything about it.
Right.
Nader's book, Unsafe at Any Speed, came out and the public forced its politicians to do something about this. And this is why you today wear a seat belt in your car and why it drives safely in so many other respects. Rachel Carson, who I'm sure you've heard of also, in Silent Spring, same thing with the chemical industry. They were polluting everything they stood on. There was DDT in the water that you and I drank. They knew it. They didn't do anything about it because it's too expensive to fix it. Rachel Carson's book comes out. The public gets inflamed. They force their politicians to do something. This is why in the U.S. we have the Environmental Protection Agency today. That's why we drink clean water instead of water with DDT in it. Has medicine lost its mind? Can do the same thing for the medical profession, inflame the public, get its politicians in gear, and do something. And you might ask, what would they do once they get in gear? And my recommendation is that they set up a commission, be a presidential commission, congressional commission, National Academy of Medicine, somebody set up a commission that does an investigation of modern medical education. And they will find it wanting. And they find that medicine is not training its practitioners in the most common health condition they will face in practice. And there's also a scientific basis for this. Medicine is the only profession, only science that does not follow a modern systems perspective. And that basically means a systems perspective means you consider all parts of a problem and how they interact, not just one part. Medicine considers just the physical disease part, not the psychological, mental, social part. And all other sciences have made this transition. Physics, everybody's familiar with, went from Newtonian physics to quantum theory. Relativity theory, and with tremendous advances. Medicine can have the same advances if it matures into a systems perspective of medicine. But it has not done this on its own, even though it has been aware of a systems perspective for medicine since the 1970s. It just doesn't do anything with it. And so medicine needs help.
Now, I want to go back to something you said before the break. Don't blame the doctors.
That's
Because,
right.
I mean, you're speaking to, it's a perfect audience up here in Canada for yell at the politicians about healthcare. Because healthcare is always a top 3 voting issue up here. We love our healthcare, right? But going from yelling at the politicians to effectively not letting them off the hook for the problem. I think that's something we can talk about with our remaining time. Because what do? They blame the doctors. Here, we don't have enough primary care physicians. That's the big deal. So people are lining up for hours when a new clinic opens up. I saw here, I was one of the first people in the door at my clinic up here. I'm semi-rural. It's jumping now. It's super busy. And they complain about how long it takes to train doctors and how expensive it is to train doctors. And so you go in there and you say, well, we need a mental health component and all these things. And they just go, can't afford it. Now that's nonsense, right? Because they're paying more for our existing system than they would for a prevention-based system.
Oh, You're right on.
Yeah. So, what's some language that people can use when they're dealing with this? Because people go, oh, that makes sense. Can't afford it. People now with inflation, they understand not being able to afford eggs, for instance. But how do you counter that? Well, we can't afford it in a system that, is spending a ton of unnecessary money treating something that could be prevented.
You nailed it right there. They they can't afford to not afford it. Is the tremendous savings that will come from addressing the psychological and social aspects of medicine are just out of sight.
Yeah.
In the US, the healthcare expenditure is roughly $5 trillion a year. If, and most hospitals, for example, are full of people with chronic diseases, okay?
Mm-hmm. Mm-hmm.
I told you earlier, you can present 80% of that.
Mm-hmm.
If you prevented 80% of that, you would save all of that money. If from a pharmaceutical houses, if you prevented that, you would save all that money that now goes to expenditures. These new drugs for obesity are costing what, $1,000 a
Yeah.
month. You would be saving all of that money. All of these people who, from, say, obesity, end up with severe arthritis and have joint replacements, you'd
Mm-hmm.
be saving all of that. And the savings in just in prevention are in the range. If you prevented 80% of this, you cut the $5 trillion down to $2 trillion.
Yeah.
It's unbelievable how much can be saved.
Mm-hmm.
And in people right now, I mean, this is just a specific example, but people with chronic diseases, diabetes, heart attacks, heart failure, strokes, 17% of them are also depressed.
Yeah.
If you treat the depression, the physical disease gets better. If you don't, the physical disease does not get better and costs 2 to 3 times as much to take
Mm-hmm.
care of. And this has been looked at, just this specific population has been shown that if we addressed the co-occurring mental disorder, it would save from 26 to 48 billion dollars every year.
Yeah.
And that's enough the money to support the National Institutes of Health. I mean, these are humongous figures that can be saved. And so the argument is change the system. Medicine needs to start training, and medical education is the centerpiece of curing all of this because it is through medical education, only 2% of time to mental health, that doctors get brainwashed into isolated physical disease medicine. And this is why they need help to get out of it, because we just keep training them the same way and they keep doing the same thing over and over. And so the public has to get involved. My website, let me tell you this, there's a way the public can get involved. It's robertcsmithmd.com. And don't forget the MD because there's so many Smiths that you will never find it otherwise. So it's robertcsmithmd.com. Okay. The very first page you go, there will be something that says Act Now. This will take you to a sample letter you can send to the President, the Surgeon General, the National Academy of Medicine, your congressperson, and your senator. The email addresses for them can all be found right there on the same place. You can even add an own paragraph of your own issues, say ADHD that you've had and where you've had bad care. But the paragraph in there advises just what I'm talking about. Set up a federal commission to investigate medical education.
Yeah. And if you're going to send a letter to your member of parliament or senator or whoever, people listening, please customize the letter. It matters. They look for form letters. I
Yeah,
always rewrite it
yeah.
myself in my own words because it means
Mm,
more. One letter written by an individual to your primary care contact person in your government means more than a protest, means more than, tweeting angrily. These letters do matter. Phone calls do matter. The entire purpose of our system
Yep.
is so that there's someone to yell at about stuff like this. So it's robertcsmithmd.com. I checked it out. It works. Robert as in Robert C. Smith, like the singer from The Cure, MD.com. Robert, thanks so much for coming on It's Not Therapy and sharing your wisdom with us. Robert's book is Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure. I'm halfway through it. It's fantastic. Robert, thank you for writing the book. Thank you for coming on here. And thank you so much for your passion on this issue. It's really, really great.
Thanks for having me. Appreciate the chance to talk to you.
All right. When we come back, more things you can do to help encourage change and keep going, because change is slow to come. Questions, comments, concerns, Liana at nottherapyshow.com. Nottherapyshow.com is my website, at nottherapyshow on socials. More when we come back on what you can do to make change on It's Not Therapy. The following program is a peer-to-peer advice show and does not diagnose mental health conditions. If you're seeking social services, please call or text 211 or go to 211.ca. We're back in It's Not Therapy. I'm still Liana Kersner. I'm still not a therapist. We're still talking about mental health and the medical system. And I want to take the remaining time to talk about what else you can do to help encourage change. Because like we said multiple times during the interview with Dr. Robert Smith, it's not the fault of doctors or first responders that they're not trained or, they have minimal training in mental health practices. With the shortage in family doctors here in Ontario, and I know we're not the only jurisdiction in the world that has a shortage of family doctors, nurses, etc., there's going to be pressure to pump out primary care doctors as quickly as possible instead of a focus on additional mandatory training in things like mental health for primary care physicians. So it's going to be an uphill battle to advocate for this additional mandatory training, which is why it's important to speak to local officials in charge of funding. Don't just yell at doctors and paramedics or claim all cops or something or other. Catchy slogan, not really effective in enacting change. When you're told the mental health system is overburdened, it's true. When you hear that first responders are under intense stress and suffer from mental health conditions themselves, it's true. When you hear that our physical healthcare system is overloaded, that is also true. As Robert said, if you're not in a major city, services are even more stretched. In some areas in Canada, the wait list for mental health services is up to 2.5 years. 2.5-year wait list. Now, the first place to look up support services is the 211 service that I talk about at the beginning of every break on this show. Put in your location on the website and search for mental health. There are usually more community services than people are aware of because they're poorly advertised. Using these services helps them maintain their funding because undersubscribed programs tend to get cut. Now, if you go on to 211 and you find that the in-person services are quite far away from you, that's very common, especially if you're on the boundary of an area. Look up the tele or internet services. Those are there, and they're usually marked on the calendars. Another source of information regarding mental health supports in your area is your local crisis line. They can inform you of where the nearest drop-in counseling center is if you don't get very far with 211. Or you can call the numbers on the 211 website instead of, doing a search, looking it up yourself. Now, sometimes the people on these lines can be a bit, rude and dismissive, sometimes condescending, but your goal is to get the information and their rudeness is on them. I know it's bizarre that somebody staffing a mental health line would behave this way, but it is true. I don't get it. I'm just saying it's so. All you're trying to do is get the information so you can take that next step. Another next step is that your local officials put on community events. Find out where and when they are and show up if you can. Eat the free hot dog. Drink the lousy coffee. I just drink the lousy coffee because the hot dog's usually meat and I don't eat meat. The point is, the more that local representatives see you as a regular person out in the community and not just a partisan activist, the more effective you'll be in persuading them that your issue matters. Talk to other people, not just politicians, about the importance of community involvement that doesn't involve protest. Politicians have tuned out protest. Real, lasting change is slow, but it doesn't take a lot of time to send a letter and make your concerns felt. If you've donated to political parties in the past, they occasionally send out surveys. Fill them out. Political parties tend to be laser focused on top 3 voting issues. Contact the local political parties and ask them where they stand on better mental health primary care. They should have a clearly stated policy in their platform. If they don't get back to you, as the Liberal Party did not get back to me before the last provincial election, well, that may affect your vote. Yeah. Now, give all of this 10 years of ongoing effort to work. That's right, at least a decade. This stuff changes slow. This is why participating in ways you can sustain is important. Manage your frustration. Manage your disappointment. Pay attention to your own mental health in this process. If you're getting overwhelmed, step back. Just be a person. You're not required to advocate. The issue will be there when you're feeling more balanced again. Trust me. The way you care isn't an indication of how much you care. Trying to get politicians to spend money on anything that isn't an immediate crisis is nearly impossible. And we currently don't have the most informed provincial government in this province. Our premier still thinks you apply for jobs by dropping off a paper resume at a local business. An area that we can get more traction on faster is at your direct community level. Committing to taking mental health seriously in the clubs and groups we participate in, including online, is essential. Don't participate in online pile-ons. Don't use social media to fling abuse at strangers. Make behavior matter. And if someone seems to be struggling, top 10 phrase, listen twice before you talk once. And if you're wondering why I'm laughing, my cat Scout is here purring right into the microphone. So that is a strange noise you may be hearing on the radio. It is a cat. It's okay. It's good for your mental health. Cats are good, right, Scout? Yeah. Now, in Canada here, there's a bit of, people see it as the promised land because it doesn't cost money to go to the doctor. Okay. Even in Canada, a lot of people don't access mental health services because of shame. They have bad experiences either with the doctor, with the mental health system, or with the people around them while they're going through the mental health system, and they just stop because it's too hard. It's too humiliating. I share my own experiences with the mental health care system and my own mental health issues to reduce the stigma for other people. And let me tell you, it's tough. People paint me as bad crazy at the drop of a hat, and they think it has more teeth because I sought help. And I talk about getting help instead of recognizing that I'm only good crazy because I got help. And the people accuse me of being unhinged or having anger problems or whatever the latest claim is. Well, there are people I said no to at least once because they didn't respect the things I have to do to maintain my mental health. When I was in intense therapy, it was hard because my family didn't accept the things that the therapist said needed to change. And I was caught between those two pressures. Therapists will drop you if they think you're not doing the work. But it's very hard to do the work if your family is referring to the professional advice as crap before they even try it. Now, trust me, it's tough when you go in and the therapist is like, do these things. And you're like, I'm trying to, but it's my family. And the therapists say, well, cut anybody out who isn't supporting you. And they're right. But unless you've gone through it, you have no idea how hard it is. Getting healthy by changing your environment can sometimes be the most painful thing you will ever do in your entire life. I can tell you it's worth it, but it's hard. Now, you can choose to not be one of the people who makes it harder. Another person's mental health is not your responsibility, but if you want them to stay in your life, you need to work with their recovery, not against it. The most tragic thing I see on a regular basis is the family of a person who is struggling, keeping them down because they're demanding quick fixes via some magical medication instead of helping with those environmental changes at the person's own pace that lead to the lasting improvements. The mentally ill person in your family is not broken. You don't send them to a mechanic for repair. And even if you could do that, it doesn't last long if you send them top speed into another crash the minute they get home again. Conversely, if you're treating them as sick and helpless, they're going to internalize that message and believe they're helpless, that it's never going to get better. Navigating the current medical system is extremely difficult, and it's important to reward efforts, going to the appointments, saying what the problem is, stuff like that, really trying, even when the outcomes are frustrating, disappointing, or even an outright setback. They're going to happen. Healthy goals are based on things you can control, and it often takes multiple attempts to get connected to the right treatment or the right therapist. It's very rarely take a pill and you're better. And you can help with the journey, even if you can't force the destination. Questions, comments, concerns, Liana at nottherapyshow.com. Not Therapy Show is the website. Nottherapyshow.com is the website. At Not Therapy Show on socials. Change is hard and it's slow. But if we never start, it never comes. And as slow and hard as it is, change is possible if we keep at it. These things gain momentum with time. You're probably feeling like it's enormous right now. Welcome to the last, 10, 15 years of my life. But I am out of time with you. You're crazy is only a problem if it's hurting you. Talk next time.